Hello, everybody. Welcome to another episode of the Data Doesn't Equal Outcomes podcast. I'm your host, Tristan Keelan from CCNY. Behavioral health and human service organizations have to demonstrate outcomes. They have to run programs that make people better and prove it. And so the mad scramble for data is well underway. But data is just numbers and outcomes are just results. Connecting the two is the work. So if it has to do with driving better results for clients using a data-driven approach, we cover it here on the Data Doesn't Equal Outcomes podcast. Very excited to introduce today's guests from Step by Step. Janet Romero, the Vice President of Operations, is here with us. Janet, thanks so much for joining.
Hi.
With Janet as well is Jeff Sherwood. Jeff is the Behavioral Health Service Director at Step by Step. Jeff, thanks for joining us as well.
Great to be here.
So our topic today is trauma, resiliency, and equity and the measurement-based implementation of that. Sounds real big and large, but we're gonna break down what all that means and hear the step-by-step story about data-driven implementation of trauma-informed principles. But before we get into all of that, Janet, maybe you could give us a brief introduction to Step by Step and the agency scope, size, and service offerings that you guys are delivering.
Sure, thank you. Thank you first for having us. And I just want to encourage people when an email comes through that says, are you interested in more information about this? Click here. That's exactly how we got to meet Tristan and this great organization. And it's been a phenomenal relationship and experiation. So please
as
click
long as
on
it's
those
not
emails.
Spam, right?
Yeah.
No viruses, but
exactly.
Yeah.
If it's from Tristan, click on it.
I appreciate that.
So Step by Step is a human service agency in the state of Pennsylvania. We began over 45 years ago, and it's always been an agency that's just responsive to whatever needs the state has in supporting people with mental health disorders, intellectual or developmental disabilities, substance use disorders. That's our goal, is just to respond and make sure that those supports are there in the community. We have 4 distinct areas of the state. Our office and headquarters is located in the northeast corner in the Wilkes-Barre area. And we provide a lot of services in the county surrounding that area, both with mental health, children's behavioral health services, IDD services. Come south a little bit and you hit Allentown, Bethlehem. That's where I reside. And again, we provide services. Although it's still in mental health, IDD, the services may look very different because the needs in the Lehigh Valley may be different. You go a little bit further south and you'll end up where Jeff is in the Philadelphia area and the surrounding counties. Again, mental health services, IDD services. And then take a 5-hour trip west out to Pittsburgh and you'll find us again in that area providing currently IDD services.
That's wonderful. That's a wide geography of service. That's wonderful to hear. Jeff, as the Behavioral Health Service Director, can you tell us a little bit about what you do for the organization?
So I supervise and manage a team of staff who go out into the Philadelphia community and provide support services to 80 individuals. So these are individuals that live in their own apartments and have different mental health needs. So it's a very, very helpful service to them. Our goal is to help them with independence. And I also supervise, we're in the midst of changing some things at Step by Step, but right now I am supervising a in-home and community habilitation program, which is a support service for our ID folks who live with their families.
Great. And Janet, Vice President of Operations, how do you fit into the organization?
Yeah, so as Jeff indicated, we're currently going through some restructuring. Up until this point, my position has been to oversee all the operations in the Lehigh Valley region. Moving forward, I'll be overseeing all the mental health operations, no matter where they occur in the state.
Okay, so let's dive into this journey that your agency's been on. And my understanding is that it really starts with the National Council for Mental Wellbeing, which is great. And it started with a survey. And can you tell us a little bit about that process and what getting that survey about the 7 modules of trauma-informed care, what did that process look like?
Yes, I'm going to back up a little bit further just in case somebody's listening and thinking, how do we step into this realm? We had a work group together that worked with dual diagnosis, and we wanted to have goals, we wanted to have measurements, and so we came up with a completely unrealistic, lofty measurement of saying, let's become a trauma-informed organization, and began taking some steps of first introducing it to our executive team, holding summits to ensure all the leadership had an introduction and were on board and buy-in with trauma-informed care. And we were just at the step of saying it would be helpful to have some consultation to help lead our organization through and to organize, because we had been doing a lot of trauma work, but it was all little pockets here and there. We wanted to organize it. And just as we were putting together a scope of work to request a consultant, we received a notice from the National Council that they were putting together a community of learning. And it was just after the George Floyd murder. And so it included not only trauma, resiliency, but also the equity part, the third portion of it. And so in the application, we had to identify some key players that we promised that would be part of our core implementation team. Jeff stepped up and said, don't know what it means, but sure, I'm on board. Our quality and compliance officer said, I have no clue, but it says it has to have data involved in it. So yes, I'll agree to be part of it. So we sent in our application, and we were really excited to be accepted as one of the 15 providers across the nation to be part of a year-long learning collaborative. And the very first thing they did was to say, so we're going to send out this, you need to survey all your staff. Our team, which were just all people, because the National Council made it very clear that it should be people from all levels of service, all the various services, people with lived experience being part of the team, support from leadership. So we just brought together all these people who said, we have no idea what we're doing, but we agree to be part of it. And so the very first thing was the National Council saying, you're going to start with a survey on surveying all of your staff, which for us is 1,100 people.
I was just going to ask, 1,100.
Mm-hmm.
So you're getting this survey ready. What type of questions are you asking?
So in the wisdom of the National Council, which is generally what you experience when you're working with the National Council, they had taken the 7 domains that SAMHSA had put together of what it means to be trauma-informed. And within those 7 domains, there's a list of anywhere from 7 to up to a dozen breakout questions on steps that lead towards being trauma-informed within those. And so what they've done is they've created each of those domains and the steps in those to be a question, and then ask everyone receiving it to rate it from 1 to 5 on where the agency is. And they do a wonderful job. They actually send out the link for us to provide the survey, and when people respond, they collect the data initially and give us a spreadsheet showing the results.
So, 1,100 people answering questions on a scale of 1 to 5. Your agency is about to get about as comprehensive of a self-assessment as you're really going to get. But before we talk about the results of that survey and where you went next, like most stories these days, we have to address, the elephant in the room, which is COVID is happening and impacting everything. So you mentioned you're undertaking this in the midst of a global pandemic, lockdown, the single most fundamental interruption to our daily activities, that, at least in my lifetime. And so what were the things that you had to consider in terms of what you were putting, onto staff at this time?
Yes, I'm going to let Jeff talk a little bit about that and what the team was really adamant about.
I think one of the things we discussed is that we were adamant about not putting any additional work onto the persons that we identified that were going to be part of this team. And I think the other major transition here is we were an agency that really put a premium on face-to-face meetings. And during COVID, we really learned how to do virtual meetings. So I think that was another helpful way that we were able to get together and meet and really kind of develop where we wanted to go with this team.
Yeah, and then branching out from that same commitment on our protection to the team members, we also wanted, as we were really committed to this transformation, not wanting to put any additional pressure on everybody in the agency, all 1,100. And that we really saw this as an opportunity to introduce a lot of trauma competency and tools and support, ways to really support our staff. So that was part of what led our chief to be really stuck initially on what we were going to select as our goals, because we just wanted to do everything for everybody and have everything in place immediately. But yeah, we were adamant that even when we sent out the survey, Tristan, to be honest, the email that I composed said, we want your honest answers. If you don't know, say you don't know. If you don't think we're good at this, say we're not good at this. Like, this is just truly tell us where we are at this moment in time, and don't feel like you need to do something or say something that isn't true of where we are at this moment in time.
Yeah, I mean, I can't help but hear that, whether you were seeing it or not, that you were being trauma informed in your approach to doing this trauma informed transformation, because sometimes, people really just need to hear that your intention is not to overwork them and overwhelm them. And sometimes just that acknowledgement of, we know how hard you're working, and, this is meant to help us, and we appreciate you, and all of that. So it's, I can tell already that even before, implementing this thing, as you might say, you were in large part already had it at heart, right?
Yeah, and what drew me to your initial email, Tristan, was the other thing we didn't want was to create more piles of paper or to fill garbage cans through this process. We did not want this to be look at step by step, can now check the box that we've done this trauma work. This was truly a commitment to say, what can we do to transform the lens of how people see one another, impact the way that interactions occur, and to help all of our staff to interact in a different way with the individuals in our services so that the individuals ultimately were receiving better services and staff felt better equipped.
Absolutely. So let's get down to, some of the measurement here. And what we really want to talk about is measurement-based improvement, measurement-based, care to some degree. So you get your survey results back, and, what did you see, and how did you react to those results?
So the results actually came back pretty complimentary for our agency, but we also really focused on appreciating the comment sections and the I don't know and why are we doing this. And so this is where the team really spun our wheels for, gosh, Jeff, I don't know, maybe like a month, maybe 6 weeks. I mean, it was a while we spun our wheels trying to come up with how to do our goals. And God bless our coach that the National Council provided. And I want to make sure I get her name correctly, Amy Roshine. She was just a real gem and absolutely never directed our team to do anything. It was whatever our team wanted to do. But we could just sense we weren't hitting the mark because we were like, oh, we're going to change the environment and we're going to do this about leadership and this on assessments. And after a while, she said the words, so what stage of change is your organization in? And then we were like, oh, light bulb moment, pre-contemplative. We don't even know what we need to do yet. So we knew we needed to start with buy-in and keep it really focused on just giving information, which took us directly to domain 3, which is having a resilient and trauma-informed, educated, and responsive workforce. Just start there. And the first 2 sub-steps in that is that leadership, both internally and then externally, demonstrate and voice support for this process. So we were able to then drill down and just have those 3, because the other light bulb moment that Amy helped us to come to is if you're measuring something in your survey, wouldn't it be nice to just focus on that as your goal? So we just reframed the questions from the survey, and those became our goals.
Great, Jeff. Anything you want to add to that?
Yeah, I think Janet's exactly right. We did spin our wheels for a little while, just thinking. I think we looked at the survey and thought, let's really try to bite a significant chunk of the survey, and maybe take on 3 or 4 goals at a time. And through the coaching, it really helped us to realize that we were just not at that point. And I think we refocused and came back to that pre-contemplative state of what can we make our goals, and that's where we really focused on that workforce domain. So
yeah. So you've honed in on one specific section of the survey. You've got a score. And you put a numerical goal against that. Is that right?
Yes.
Can you talk a little bit about, your target objectives in terms of the numbers?
Yeah. So for our first goal, we had received a score of, I believe it was 3.7. And we wanted to raise it up, 3.75, and we wanted to raise it up to a 4.0. And that is staff's awareness of leadership, communicating a clear message of support for the transformation. And the second one, we had received a 3.5 on how much information staff had about trauma. And we wanted to increase that up to 3.75.
Just to keep those numbers in perspective, I assume you're talking about an average of 1,100 surveys. So to move the needle, even the quarter or half a point is it does represent a big change in an organization of your size.
Right.
Make sure we have that for context. Mm-hmm.
Yeah,
okay,
and we wanted not only the team, but for staff to feel successful. Like that was one of our goals, is we wanted to really have a goal that was reachable, so that everybody involved felt like, oh, look at us, we achieved this in our agency.
And goals should be attainable, absolutely. So now on to the fun part. How are you going to do it? How are you going to, or maybe not how, what are you going to do as an agency that's going to reflect, higher scores on these questions the next time around?
It was the fun part. And this part actually took some time before we could even start working on the goals. And we knew we needed to start with buy-in. And so we started with branding. And luckily, we have some real talent in our agency on the team. We had a team member who had been involved in marketing, and she and I just love graphics, working on graphics and all sorts of ideas. So this really did become a fun part. So the first thing we wanted to do was rename the overall project. The Community of Participation with the National Council is a very long name. It's maybe 15 words. Well, that wasn't going to work. Nobody's ever going to remember what we're involved in. So we came up with trauma-informed, resilience-oriented, and equity-focused, and took the first three letters of those three terms, TRE, and chose to pronounce it TRE. And once we had that, then we wanted to come up with a symbol or logo that every time staff saw a piece of information that was related to TRE, that it would be immediately recognizable because it would have the TRE logo. And so we really wanted it to represent part of what was important to us, and that is the involvement of everyone. And we wanted it to be something that people would find as attractive and enjoyable. So we came up with a circle with TRE in the center, the words around it, and it's very colorful. I can hold it up so that everyone can see. And so any piece of information that goes out, we include the TRE symbol. Once we had our name and the branding, then we were at the point where we had to somehow announce to everybody that this was happening. And we didn't want to announce it. Like I said, we are into filling garbage cans with pieces of paper or putting piles on people's desks. So we wanted to come up with something that truly represented how helpful this is going to be, and that this is going to be a year of receiving tools and support. So we thought through some of our trauma training that we had, and we recalled the gift of drinking a glass of cold water when you feel stressed. Well, we can't send glasses of cold water, but we can distribute bottles of water. So we decided to start with just coming up with a label that explains the science behind why drinking water helps to calm the brain and how it can disrupt moments of anxiety, along with a 4x6 card that also had the image of it. And on it, we introduced something else that we would be using, which is the hashtag TREBIT. So we introduced the concept that you're going to be seeing hashtag TREBITs, which means you're going to be seeing a bite-sized piece of information that's going to be helpful to you. So that's where we started. The back of the card gave more information about who Trey was and what was going to be happening, and that everybody was involved. It wasn't just a team of people sitting in an office thinking of things.
I think the
Do you
other
mind?
thing too, just as we were thinking of ideas, which this was a great idea, that when that water bottle went out with the card, even for our staff that may not have fully understood as they're getting used to this concept, talking about why am I getting a water bottle? So already it's a discussion about what it is, and then you can clearly see what's on the label, and you have the card to kind of explain it more. So I think we really had that wow factor in starting out our tray bits going out to all our staff.
Yeah. Can either one of you read from that card, just the front of that card, real quick? What does it say on that on the card about the water?
So the card says, at the top it says becoming trauma informed, and then just beside the glass of water it says, did you know that drinking a glass of cold water is a perfect tool to de-stress? And then Trey bit, think cold water.
Bite size, easy to communicate, connected to your branding. This has all the makings of I'm gonna pay attention the next time anything that looks like this comes my way, and there's going to be plenty more. So, what an excellent exercise in internal messaging and branding to your employees versus those outside your organization. So yeah, you've got a whole internal marketing project. You're now your own water distributor. You've got your own hashtag. I mean, this is great. Where do you go next?
So we went from our knowledge again of trauma and knowing that safety is the very foundation when you're talking about trauma. And I'm going to turn over to Jeff when we started talking about beginning with safety plans and making sure staff knew how to keep themselves safe.
So we really wanted to try to get out, just as Janet's saying, safety plans and kind of brand that as well. And a safety plan is really one of those things that all of us could look at and look at to see what were some internal factors and external factors that we could use for ourselves if we're going through a traumatic moment. So we decided that it would be really good if we could put that on a card, and we put it on a business card. And maybe Janet has one of them there she can show. And so you see the really nice scene with an umbrella in the back where you have the external and internal factors you can use. And all of this really led us into shooting a video, completing a video for our organization that really painted a picture of how you could use that safety plan. And we had a couple of members in our Trey team. One was a videographer who really had done some work shooting movies and had some experience with this. And we decided to make a vignette of what it would look like for a mother of three whose husband had a serious illness, who was no longer working, and she was the sole provider for the family. And we really painted the picture of what it would be like for that person, this mother, to use that safety plan, the with and without the plan, what that would look like. So we had a lot of fun with this project, and I think the project really touched a lot of people because you were able to see an example of this in use. And that's really what we're going for, is just we can talk, we can use all of the terms, but until you can put it in the perspectives of somebody hearing this, and real life examples work well. we thought that video came off really well, and we sent it out via YouTube. I still look at it. We had some narration with it, and I was one of the narrators. And I have to say, I'm not one that really enjoys hearing my voice, even though I'm told it's pretty good. So, the video accomplished quite a bit, I think, in really propelling Trey even more forward.
And Jeff, maybe talk about who kicks off the video.
So the person that kicked off our video was our CEO, Eric Lindy, and he came on to discuss and introduce the team. And he also held up his safety card and talked about that. And so that was, I think, again, a really effective way for buy-in for our staff to see, oh, there's our CEO, he's on this video. So he came on the video, and then after that, we got into discussing and then showing the vignette and the story involved.
That's a powerful image, right? The top of your organization showing that he has a safety plan. What better way to demonstrate to 1,100 people that nobody's exempt from this. This is culture. This is what we're all striving for, and no matter where you are in the organization, there's no exception. Right? It's pretty powerful. So where are you today in terms of your Trey project?
Yeah, so we ended out the year introducing other topics like resilience, equity, through some of the same processes that we've been talking about. Made sure there was a page on our website so people could go back and have access to it, still hand out the bottles for everybody that's onboarding so that it's the same message as soon as somebody joins the organization. So in July of last year, it was time to do the survey again to say, how did we do? And our goals were 5 100ths shy in each of the two areas of what our goals were, which we were really, really happy about. That's pretty darn close to hitting the goal. So we decided to really focus on just the learning or training aspect moving forward and set the bar higher, because we had set the bar at 3.75 last year, and we want to set the bar at 4.0 for the response that we get this year from the survey. So this whole year has been focused entirely on getting information out, and we've contracted with there's a local organization called Lakeside Global Institute that works with Sandy Bloom and Dr. Perry and just the best of the best in the trauma field. And they've put together incredible trauma curriculums that, again, some of us independently had been involved with, but the agency as a whole purchased a package of the products to do exclusively with our agency. So we bought 5 of the workshops where 100 of the employees at a time could go through. And we also purchased the capacity for 16 of our employees to go through the becoming a trauma competent professional, which is 3 courses that last over a year long. And it's just an exceptional. Jeff and I have both independently been through that, so we knew it was an exceptional process. Also, just getting the word out to staff whenever possible that there's any other external trainings. But we also wanted to have a foundational trauma training that everybody who's associated with step-by-step could view. And I'm going to turn it back over to Jeff because he's one of the creators of that training.
So I worked with 2 other really brilliant people to develop this kind of introductory training to explain trauma-informed care. And we really focus on the trauma part as far as explaining what trauma is. And we borrowed from SAMHSA, but we wanted to talk about the events of trauma, the experience of trauma, and just the effects of trauma in our lives. So this is something we just completed, and there's going to be a rollout to making sure that this training, we're still trying to work out the details, but having this training available so that we can have our new staff and have all of our staff get this training, and further really develop their knowledge about trauma. When I came onto this team, an important thing that I told Janet is way back, I won't tell you how many years ago, I was working in an intellectual disability program, and we had an individual who part of her behaviors were to throw a chair or her walker. And one day I had a staff ask me, get her to stop doing that. And it really hit me that we didn't understand this individual and what this individual went through that is kind of propelling her to do these actions. And I think the training here is really linked to that. You know, we want to understand our individuals, we want our staff to understand themselves, and not just to see things as a behavior, but to see things, to see others as individuals and take that holistic approach to gaining that knowledge to better support them. So this is something we're really excited about, and I'm just excited we're going to be able to do even more things in the upcoming years.
And to your question of where we are, Tristan, our team just met on Monday, and I think we've mentioned a couple of times we're going through some structural changes with our agency. And part of what we talked about is this is a nice time for us to step in and remind people of tools, or are there more tools that we can supply to show that it's not just something we talk about, but this is real life. Like when you're facing a change, how can trauma be there as a way to support? How can our connections with each other really build our resilience, and to show how can we show that as we're making these changes, we're being really equitable in our thought process on how decisions are being made, and being very intentional.
Yeah, I think there's, I don't think there's anybody out there today who's going to argue against trauma-informed care, right? Most agencies are implementing some version of it. But what I think is really special here is that you have measurement tied to it. And starting with those survey scores, and taking your time to identify a couple of scores you're going to try to influence, and putting a target goal number against those. And by the way, missing your goal by 5/100ths means it was the right goal, right? It was the upper ring of where you could move the needle, and there's, you still room to go, but you're not so far off that you can't celebrate it, right? And, so when we first started talking, I was drawn to this story because, we believe in data-driven decision-making, and we believe in trauma-informed care, yet we talk so often about the math of trauma being in assessment scores and, client-driven and all of that, has its place too. But to know that in your cultural implementation of it, you have a number that you're following that, you know exactly whether what you're doing, who you're paying, the trainings you're doing are having an impact on your staff or not. And, that should be applauded. I think it paints a really clear picture of where this project started, how far it's come, and that everybody should feel good about the results. There's no question in there, but I certainly throw it back to you guys for a comment.
Yeah, and I think I think the team feels really good about the approach that was taken, and that we didn't just focus on let's do client assessments and some things that just were focused on some of those check marks that maybe make funders and some of our applications. Not that we're not going to do those, but we really, really wanted the people who are providing the service to have it part of their makeup, to understand, and to incorporate it into their daily life, so that it's not asking them to do a task with other individuals, but to just live and to interact with people in a way that they understand really works.
Yeah, that's an excellent sentiment. Okay, so do you plan to do the survey ongoing once a year? Is that about the plan?
Yeah, so this survey will go out in our fiscal years are July through June. So we'll send the survey out in June that will help direct our goals for the next year.
Well, we'll have to have you both back on in the next season to check in and see how the numbers are moving. As it keeps going on. We always talk about continuous being the most important of quality improvement and keeping things moving, being a critical component. So before we wrap up, I want to ask each of you a question individually. Jeff, why don't we start with you? I'm going to ask you both the same question. What advice would you give to yourself if you could go back to the beginning of this project? What's the one thing you wish you knew then that you know now?
To be patient with myself. I think looking back then, as we've talked about here, we had a lot of ideas and really just kind of a lot of thoughts about, we could do this and then we could do that. And there were just so many things that we thought we could do. And we really had to go back and again, rethink and start at a more manageable goal. So that's what I'd say to myself.
It sounds like your team processes did a good job of keeping those reins in whatever team meeting process, whatever conversation you guys went through, definitely boiled it down into manageable change. So something's working there. Janet, how about you? What advice would you give yourself?
Mine mimics Jeff's a lot. I'm a person who thinks of all sorts of great ideas of we could do this, this, and this. And the logistics of a statewide organization with 1,100 employees, some of which who work 50 miles away from the closest office. So, and during a pandemic when everything's closed down, just logistics of being able to reach people was not an easy task. Just appreciating that how much was accomplished, even though we felt like, but we want to do so much more. When we look back, it really was a phenomenal year. And also that time is a gift, that allowing people time to incorporate things and to discuss and to ask questions is a gift, and to not always just focus on achieving the next thing and the next thing and the next thing, because sometimes then those things don't actually get incorporated and you're not doing transformation, you're just doing tasks.
Time is a gift. You heard it. That's an excellent way to conclude this episode. This has been the Data Doesn't Equal Outcomes podcast. Thanks everybody for listening. My guests today have been Janet Romero, Vice President of Operations, and Jeff Sherwood, Behavioral Health Service Director at Step by Step. Thank you both so much for joining us today.
Thank you.
Thank you
for having us.
Thanks.